Good afternoon and welcome to the Childhood Trauma Learning Collaborative webinar, Back to School, Open Up with Optimism and Connection, with Director of the School Mental Health Initiative of the New England Mental Health Technology Transfer Center, Dr. Martha Staley, CEI Executive Director, Dr. Kristine Mason, and Founder and Chief Playmaker of the Life is Good Playmakers Foundation, Steve Gross. My name is Dana Asby and I will be your webinar manager and host. Today's meeting will last approximately 1 hour. Microphones will be muted during the presentation. At designated times, for example, during our question and answer session, you can use the raise your hand feature to request an open mic. When speaking, be sure to eliminate background noise. Throughout the presentation, you can also submit questions in the chat box. Thanks to a partnership with C4 Innovations, we're offering 1 hour of continuing education credit for participation in this webinar. We can also offer you a certificate of participation. For record-keeping purposes, you must identify yourself while on the meeting platform using your first and last name or the email address you use to register for this event. You can either ensure your name appears as a part of your video panel or enter it in the chat box. Registration affirms your consent to receive an evaluation follow-up link via email and your consent to recording. Your instructions to get a certificate of education, as well as a copy of this presentation and a link to the webinar recording will be included in that email. If you experience any technical issues, please send a private chat message to Ingrid Paget, our technical support manager for today's webinar. We're pleased that you joined us today for this webinar. We're very excited to welcome Steve Gross from Life is Good Playmakers Foundation. We were introduced to his wonderful organization by Boston Public Schools and their comprehensive behavioral health model program. They work very closely with Boston Public Schools, who we've had the honor of learning more about and writing about. So I'm very excited to introduce Dr. Kristine Mason, an educational psychologist and CEI's founder and executive director, as well as the director of the New England MHTTC's Childhood Trauma Learning Collaborative. Dr. Mason is a nationally recognized expert in the area of educational reform, mindfulness, teacher mentoring, and special education, and has made more than 500 national, international, regional, and local presentations on these topics. Dr. Mason is joined today by Dr. Martha Staley, who is the director of the School Mental Health Initiative at the New England MHTTC. She's also an instructor at the Yale School of Medicine, Department of Psychiatry. Martha has a background in integrated mental health and primary health care and mental health education in school and college settings. Dr. Staley will be in conversation with Steve Gross, the founder and chief playmaker of the Life is Good Playmakers, a nonprofit that spreads the power of optimism to kids who need it most. Steve's signature approach has been widely adapted across the country and throughout the world in response to the social and emotional needs of children deeply impacted by poverty, violence, and illness. In addition to his work in the social sector, Steve has worked with many corporations such as Vertex Pharmaceuticals, Million Dollar Roundtable Club, and IBM to demonstrate how optimistic leaders can inspire people and organizations through times of change. I now turn the webinar over to Dr. Martha Staley. Oh, I've just gotten a message that Martha is experiencing some internet technical difficulties. So while she reconnects with us, we would love to hear more about the Life is Good Playmakers Foundation from Steve Gross, founder and chief playmaker. Steve, could you tell us a little bit about your foundation?
Sure. Thank you so much, Dana. I'm grateful to be here, everybody. I know you're probably thinking it's pretty easy to be optimistic when you got a blue sky like this behind you. But if it makes you feel any better, it's just a screensaver and I'm in my parents' basement. The Life is Good Kids Foundation has a very simple mission. It is to spread the power of optimism to help kids heal from the potentially devastating impact of childhood trauma associated with growing up amidst poverty, violence, and illness. And the way that we do that is by partnering with the frontline men and women who dedicate their lives to building healing, life-changing relationships with kids. Really, they're the real heroes. You're all the real heroes. You know, if you think about sports, in sports, you refer to somebody as a playmaker because when the game is on the line, you want them to have the ball because you know they won't shy away from the moment, and they're going to do something or give their best effort to do something that changes the outcome of the game for good. Playmakers in sports are great, but playmakers in life are much more important. And so we think about teachers and nurses and social workers and coaches and counselors who every day commit to making life-changing differences in the lives of kids. And to do that, to be exceptional in the life-changing relationship business, obviously you need a professional skill set. If you're a teacher, you got to be a great teacher. If you're a nurse, you have to know how to give medical care. If you're a clinical social worker, you know how to deliver clinical interventions and services. But in addition to that professional skill set, you need a human disposition. You need to show up filled with love and compassion and energy and joy and gratitude, because really it's those human skills that are so instrumental in healing. So if you just show up with a great professional skill set, but you don't show up with an optimistic human disposition, it's going to be tough to reach people, especially people who haven't had a lot to care about or to feel optimistic about. So our focus has really been about partnering with frontline care professionals to help them cultivate their optimal human disposition as a healer. I wouldn't call it training. I think we love to call ourselves navigators and guides to help people to discover those things about themselves that have allowed them to be effective in building healing, life-changing relationships with kids.
So Steve,
Yes.
I'm thinking about optimism and play and looking at where some of our participants are from. And we have someone from Puerto Rico, someone from Grants Pass, Oregon. Martha and I are both from the Northwest. And I used to have an aunt in Grants Pass, actually. So it was wonderful to see that. So much of our work is in New England. So I just want to say, no matter where you are, play is something you can do. You know, you don't have to be in an idyllic setting to play. You don't have to be in the mountains or at the beach. There's ways that play can happen in cities, on farms, in classrooms, in homes, for young kids, old kids, and all of us. Is that right?
Oh yeah, I mean, absolutely. I don't think play is really so much about what you do. It is the why and how you do everything that you do. And so we sometimes think about like, hey, okay, if I'm, in a soccer game, I'm playing soccer, and if I'm at work, I'm working. But really, when you bring a sense of joy and connection and engagement in what you're doing, well, I would consider that play. I feel like I'm playing now. I feel fortunate enough and blessed enough to have a job that brings me so much joy and allows me to connect with amazing people and allows me to be engaged and feel meaningful, that is play. I think sometimes we assume that just because somebody's at the beach or somebody's got a soccer ball that they're playing. But if there's an absence of joy, if there's an absence of connection, if there's an absence of a feeling of safety or empowerment, it's not play. It may look like play on the surface, but in order to be play, you got to feel that, you got to feel it. As Bob Marley once said, who feels it knows it. And I think when we're playing, we got to be able to feel it, and you can play anywhere at any time.
So think back a few years ago, or maybe even last year, before COVID. Remember the focus on academic achievement and how we had 3 and 4-year-olds even sitting at desks, learning to write, right? And do math and read. And some people said that wasn't developmentally appropriate. Now, in my organization, we taught some classes for STEM and STEAM for preschool kids. And we had so much fun engaging teachers, teaching them strategies so that kids could play and learn together. And over the last few years, we've also written these newsletters. Someone would come and we'd say, what are kids doing? What are they doing outside? Are they going to summer camp, right? And even with social distancing, we know that we have some summer camps going on. Equity, of course, is a huge concern. Not everyone has the same opportunities. So Steve, what do we do knowing that we have differences? Some people will have easier access to fun. Others won't have some things so immediately available. What can we do to bring this spirit of fun and play to their lives?
Well, I think again, it's making a commitment. It is prioritizing and believing and not looking at something as just kind of superficial or fun. I mean, when we look at play or education, they're synonyms. They really should be synonyms. So we define play as freely and joyfully engaging, connecting, and exploring with the world. And we have to prioritize that. We have to say that this is essential to the education of young children, it's essential to their psychological well-being, it's essential to their physical well-being, and not looking at it as an extra. Sometimes teachers say, well, we don't have time to play because we have to prioritize learning. We have to prioritize math and science. And you say, well, we got to play math and science. If we think about what fun is, fun allows somebody to be fully present in a moment. When kids are having fun, they are here now, they are engaged. Well, academics, if it's fun and it can engage kids, we have tremendous potential to teach kids. I think one of the most important things that we can do to any experience with children is figure out how do we weave it and how do we make it fun? How do we bring a sense of joy? You're doing well when kids are looking forward to going to school and when they think school is fun. When we survey kids in schools and ask, in high school students, I forget the number, but it was over 85% of high school students were describing school as boring. Boring is the opposite of fun. And so it's not a surprise that, a lot of students aren't reaching their academic potential. And so it really is on us to make it a priority that we have to make learning fun. And if you don't like the word, look at engaging, inspirational, meaningful, joyful. These are things that are not extras. They're essential. And especially this piece when we talk about, kids feeling more isolated, more overwhelmed, not having the same supports available to them. Well, the social and emotional well-being of children, they're so vulnerable right now, especially kids who relied so much on additional services because maybe they weren't getting fed as much as they need to socially and emotionally at home for whatever the reason being. And so, protecting that, children who have opportunities to engage in safe, loving, joyful, engaging activities, that's the cornerstone of good strong mental health.
So, we talk a lot about opening up this fall, right? Huge emphasis right now on, will there be school in buildings? Is it going to be virtual? And I'm thinking that, there's ways to have play and fun and optimism, no matter what conditions we have. And Martha, I'm thinking about the work we do in New England, okay? And our fellows and everything we're trying to do to get people ready for whatever happens this fall. What do you think when it comes to optimism? What are some of the things, Martha, that you think we can do to help teachers, educators be better prepared for a sense of optimism?
Well, first of all, hi everyone. I'm Dr. Martha Staley. I was all set to join you at the beginning of the webinar, but I happen to have two 14-year-old boys who hopped on the internet to stream YouTube at the same moment that the webinar was starting, so there was no more bandwidth for me. So I don't know if we're talking about kids and being a parent or a teacher. There you go, I got kicked off my own Wi-Fi. So I'm just so happy to be able to join you today, and to be able to talk with Steve and Chris and see all of your faces today as we're talking about this really important issue of optimism. And I became interested in talking with Steve because I am absolutely an optimist, but I am raising two 14-year-old boys who swear that they are not optimists and will never be optimists, and wonder what the point even is of going back to school in the fall, right? And now that they've been off since March. And, I was very interested in what Steve would say to that. So even though Chris asked me about, teachers and optimism, I find myself struggling with both sides in my home and in schools with transmitting the optimism that I feel. So, Steve, what do you?
Well, Martha, I would say, I think the first thing that would be important is to define kind of how we define optimism. So, this idea that life isn't easy, life isn't perfect, there's pain, there's fear, there's sadness, there's loss. I mean, being alive is not easy. Optimism isn't this thing that everything is great. Optimism is our capacity to see the goodness and value in ourselves, to see the goodness and value in others, to see the goodness and value and opportunity in the world around us. I don't love this idea of saying we're either an optimist or we're a pessimist. I think optimism is this capacity, and we all have it. And so I look at myself as a practicing optimist, because it's not always easy to be an optimist for human beings. We tend to have, as Rick Hansen has pointed out, a human negativity bias, where our brain is more like Velcro for negative information and Teflon for positive in the service of wanting to survive. So we pay more attention to scary news. We pay more attention to sad news. We pay more attention to frightening news because we feel that's more of a threat to us. And so, this capacity to see goodness is so important, to see the resources around us. So when I have a 14-year-old, and the other thing I think that's really important is, people don't like optimists when they're feeling really sad, or they're feeling really angry, or they're feeling really vulnerable. And then some optimist is in their face telling them to cheer up and just be positive. I've had people say to me, Steve, I'm not an optimist, man. I'm a realist. And so I'll be able to say, cool, I get it. What's really going on? And they may hit me with a bunch of, hey, we got this pandemic. We have racial injustice. We have unrest. We have pain. We have suffering. We have a polarized political system. And I'll say, cool, yeah, I get that. And then I'll ask them, is that all that's going on? Because I think there's other things going on as well. So we have people who are fighting for racial equality. We have people who are helping people who are sick. We have people looking to create vaccines and to heal. There's always flowers for those who choose to see them. And so this idea of optimism being our capacity to see goodness, value, and opportunity, we need it most when things are bad. And we're not acknowledging, we're not sugarcoating that things are really challenging. So with a 14-year-old who says, I don't see the point in going to school, I think the first thing is to validate that. Wow, yeah, it's hard right now. I hear you that you're suffering and that you're struggling. And to first meet people where they are. And then maybe to say, well, before this, what was the point? Was there ever a point to going to school? So let's get back to that. And then being able to say, well, let's try to look for those points together. Because there is some point, even if there's no point whatsoever. Well, what do you think some people think the point to going to school is? Oh, to learn some things, to make some friends, to get an education, even just to get out of the house. Okay, so we have to be able to let people mourn the things that we've lost as we help them try to begin to see goodness. And again, I think what's really important is our brain, when it's really functioning in the best way, is wired and built for two things: for exploration and affiliation. That's what school is about. You go, you affiliate with people, you explore, you learn. But then there's another part of our brain that's always on, but it's in the background usually, which is about preservation, survival, detecting threat. And I think right now, with everything that's gone on, that preservation piece is making a lot of noise. And so now we're looking at how we're going to survive, how we're going to handle threat. And with all living things, when we feel safe and alive, we're open to exploration. And when we get scared, we close down a little bit. And so I think that piece of helping kids to feel empowered, safe in the moment, and then maybe beginning to help them think about some of the things that they're grateful for right now, and some of the resources that they have, their own strength, the strength of the people around them, what opportunities they have. But you don't want to cram it down kids' throats, and I think acknowledging that thing which says, wow, I really hear that you feel so sad right now. And there's been so much struggle here, and I understand and I hear you. And then we can start to try to crawl out of it a little bit to widen our perspective, so we're not only seeing the negative and the threat, but we're also trying to see some of the goodness around us.
I love that answer. That's such a wonderful and nuanced answer, and I love this idea that you're talking about the practice of optimism as if it's a practice. And I wonder, as I'm thinking about my experience as a teacher and also as a parent, about making that practicing of the optimism explicit with kids. What you think about that, like saying, like, I too am really struggling with this today. This seems really, really hard. Here are the things that I'm doing or we could do together, maybe to at least act as if, right? And so I'm wondering what you think, like bringing it back to being in the classroom with kids, where you're trying to manage the very real mental health needs, perhaps trauma experiences of kids within the classroom, and many of them at once. When you as a teacher also, you may be struggling or may be grieving a loss during this time or feeling anger about the situation. I wonder if you could talk a little bit about balancing your own needs and many, many other children's needs in
Sure.
such a complex time.
Sure, and I really appreciate, being able to speak here. And I know that everybody who's here will have amazing answers and opportunities as well, because there's not one right or wrong way to do things. There's 1,000,001 right ways to do things. And so, but I think one of the most important things that we look at as playmakers is you cannot spread to others what you do not have for yourself. And, I know it's kind of a cliche, but when people talk about you have to put on your oxygen mask first before you can help somebody else, because you're not going to be able to help them if you can't breathe. And, I think when it comes to these important factors, especially around social and emotional well-being, finding a sense of joy, feeling connected to others, finding a sense of feeling safe and empowered, or feeling engaged and inspired in our ability to be present. We can't share that with kids if we don't feel it. So we always talk about, more is caught by children than taught to children. So our own kind of social and emotional well-being has to take the priority. And it doesn't mean we're selfish. It's just we can't do that job. We can't fake it for that long. You can maybe fake it for 2-3 days. Maybe if you're real good, you can fake it for 2 or 3 weeks. But we can't fake it long term. And so having your own, what we call playmaker practice, which is saying, what are the things that you're doing on a daily basis to enhance your sense of joy? Who are the people that you need to connect with, whether it's on Zoom or whether it's on the phone or whether it's social distance, that help you to feel balanced and when you're with them, because they love and care for you? What are the things that you need to do to feel some level of safety and empowerment? And what are the things that you need to do to stay inspired and engaged? And it's tricky, man. When we lose our mojo, it's such a hard thing to be around kids. At the risk of disclosing too much, I lost my dad a couple of months ago. And, I'm still in a lot of pain. And I have a plan. I have a plan that I try to stick to, which says, what am I going to do to keep myself strong and balanced? And it may be as simple as paying more attention to being hydrated, watching what I put in my body, making sure I'm getting the right mental health supports that I need. What are the things that I need to do to get joy? I need to be outside. I need to hike. I need to mountain bike and I was able to tell my kids, Dad's hurting right now. And so I want you to know, I love you. And you're used to seeing me laughing and singing in the kitchen. And it's going to be back. But right now, my laughing and singing in the kitchen, it's not coming as natural as it used to. Because your dad is really, really sad right now. And they were sad too. And this is normal, this is healthy to feel different emotions. And so, again, I think that sometimes this idea of optimism, it gets kind of like tossed aside by some of this. People say, this positive psychology BS is ignoring the challenges of life. No, it's not. It's about seeing and feeling all the challenges of life and then being able to also see goodness and opportunity. And so I think that real important thing is for us as care providers, we have to have a plan for ourselves. And if we don't, it's going to be very difficult. This is not, I won't even think of it as self-care, because it's the care we need to do to deliver the best client care. Just like if you're a professional athlete, you got to work out and do strength training and conditioning. You're not like that athlete's so selfish. They're strength training and conditioning. They're doing that because they need to perform on the field. Well, we need to perform in the classroom. And how are we going to perform if we've lost our joy? If we've lost a sense of feeling some level of empowerment, some level of inspiration and engagement. So I want us all to shift that paradigm and ask the question of, what do I need for my joy? What do I need for my connection? What do I need for my sense of well-being and safety and inspiration? And then making that a priority.
So Steve, when I listen to you talk about that, I think that sometimes we can find joy in very small things. My mindfulness background says, a mindful breath, and I have to tell people I'm gardening for the first time in years. And just to see those zucchini blossoms turn into little zucchinis is just amazing. So I go outside and I'll water the plants and I listen to the birds. And I'm spending more time outside than I have for years. And there are many of those small moments that work pretty well, even when I'm not so sure about the big picture. So I think that whole thing about being fully present and taking advantage of the small things that make us feel better, and then helping our children to understand something about that is important. Do you have some exercises that you take people through, teachers or students, to help them better understand that?
Well, first thing I want to say, Chris, is absolutely. One of my favorite quotes is to pay attention to the little things, because one day you realize they're really the big things. A moment of, what you talk about gardening, about a breath, it's about being present. It's about being in that moment. And it's amazing sometimes how difficult that is for all of us. And so, one of those things is we talk about doing a lot of exercise around something we call active engagement, which is about being here now. And how do we practice being here now? And I think sometimes mindfulness is intimidating to some folks, because they think, well, you have to be a yogi, or you have to have a meditation practice, or it's this kind of Eastern spiritual thing that's just not them. And we always talk about, I sometimes call it nowfulness. And one of my favorite Zen expressions is when making rice, make rice. So we'll do activities where you help people to be mindful by playing together, to be in the moment, to take a beach ball, to make a circle, to put on music, and to be able to tap a beach ball together for a couple of minutes. And we talk about having a playmaker's mind, a playmaker's body, and a playmaker's spirit. Well, a playmaker's mind is simply to be here now. Easier, it's simple, but not always easy to do. A playmaker's body is about physically experiencing what you're experiencing, seeing it, hearing it, feeling your feet on the floor. And then a playmaker's spirit is simply about breathing and smiling. And so whenever you get lost, can you go back to feeling it, listening to the music, tapping the beach ball, feeling your feet on the ground, breathing and smiling? You know, my dad used to always say that was his trick to a long life. Just keep breathing. And he said, as long as you do that, you're going to be just fine. And I would add to him, you know, just keep breathing and just keep smiling. And I think it was Thich Nhat Hanh who said, sometimes your joy is the source of your smile, but sometimes your smile is the source of your joy. And so sometimes those simple things about remembering to breathe and smile, sometimes I have to remind myself to breathe and to smile. And to grow a vegetable, I mean, what's more empowering than that? These simple pleasures of actually creating, helping to create the condition for life to emerge. That may be simple, but it's incredible. And so, you know, I wish I had a little bit more of a green thumb, and I'm gonna, you know, work on it. But paying attention to those simple things is a really important piece. And I think that's something that we really try to do at Playmaker Discoveries is trying to help people to be in that moment, to be here now. And when we think about kids who've had a lot of trauma and a lot of pain, they often miss now because they're stuck in some of the shame and horror of the past. They're preoccupied and worried about what's going to happen next. And in being stuck in the past and worried about what's going to happen next, you miss the actual moment. And, you know, I always find when I can get in that moment, there really is no anxiety. There's really no fear. If something was threatening in that moment, you'd react to it. You'd have to. But fear usually comes from the anticipation of something in the future or thinking about horrific events in the past. So anything that helps put us into the now. And, you know, when I was talking about, you know, when making rice, make rice. When taking a shower, do you really take a shower? Do you show up for your shower? If you're like me, sometimes you take a shower, you wonder, did I even wash my face? I don't remember, because I was thinking a million things. So maybe when I get in the shower, can I feel the water? Can I smell the soap? Can I feel how that feels on my body? That's about being present. And so whether it's growing a zucchini, taking a shower, walking, you know, outside, doing the dishes, can we actually show up for those moments? And that's really what true mindfulness off the mat is about.
Steve, I'm wondering, Chris and I are doing a lot of work with New England teachers and working with them to help support their students who, as you refer to it, may have experienced a lot of trauma or loss, or who are struggling. And so I wonder if you could just say a little bit more about how finding joy might help kids process those losses and those traumas that they've experienced in the last couple of months, and how that joy particularly might help kids cope.
Sure. I would say, you know, one of the things that, you know, joy is a piece of it, but I wanted to introduce kind of a playmaker concept that joy is a huge piece of it, but it's not the only piece of it. And the concept that we always talk about, we call O-places. O''places. And it's the merging of two words. The first word is oasis. And an oasis is a respite from what is difficult. It is a safe haven. And so all kids need an oasis, a place where you can go and feel protected, water in the desert. So that's the first part of the word. And then the second part of the word is play. And play being defined as being able to freely and joyfully engage, connect, and explore with the world. So all healing must take place in and no places. Because if kids don't feel safe, even in that moment, or seen, how are they going to heal? And that when you think about freely engaging, connecting, exploring, well, that freely is a really important piece. Because trauma is about things that are forced onto you that you have no choice. You're powerless. And so when you have a safe environment where you have freedom and choice to explore, and especially explore joyfully with a sense of pleasure and purpose, and that's going to look different for different kids. And so, you know, I think that there's a piece where joy will come together, but it doesn't really happen without a sense of safety. And joy won't really emerge without a sense of connection. And so then when we can find what's going to help that child feel some sense of pleasure and purpose, well, then joy emerges as kind of part of that equation. So, you know, I think this idea of an enduring sense of positivity and connection and a sense of safety, I think it's so instrumental. I don't know how you heal without joy. And again, even if you're struggling to find joy in a moment, even being to look back and remembering joy or imagining joy. But I've never found it. I've never met a kid. I'm 53 years old. I've gotten to meet lots and lots of kids. I've never met a kid who completely lost their ability, completely lost it to experience even a moment of joy. There's some way to pull in that joy. Now, maybe I'm fortunate, but I've met kids from all over the world who've had almost indescribable trauma. And still, with the right energy and the right connection and the right safety, we can allow them a moment of respite to experience joy. I wanted to share, if I could, and I'm sorry for being so long-winded. I don't know, maybe I had 2 cups of coffee today. But I had a teacher in Turkey, so we were working in Turkey in 2000, because I think this will be very relevant, who, after the earthquakes in Turkey, we had introduced a play-based curriculum, and she was doing it with older kids. And so she was trying to get the kids to play this silly game with a beach ball and dancing, and one of the kids was outraged. And he said to the teacher, "How dare you? Don't you realize we had an earthquake and many of us lost family members and we lost our homes? And don't you realize that we live on a fault line and scientists are saying that any day we could have another earthquake and we're still feeling aftershocks? And you have the audacity to ask us to play a stupid game with music and dancing and a beach ball?" And the teacher, who was beautiful, she didn't get defensive. She took a glass of water and she put it on the table and she asked the group to circle around the water. And she asked the group to look at the water and see if they could see a vibration in the water. And then she said, "Is the earth shaking now?" Kid said, "No." And she validated and said, "I know that you all have lost a lot, that we've lost a lot. We can't change that. And I agree with you that we don't know what's going to happen tomorrow. But what we've all agreed on is right now in this moment, the earth is not shaking. So in this moment that we have where the earth is not shaking, I invite you to play. And if you don't want to, I invite you to sit and watch." And a bunch of kids came out and played. And then a few more came out and played. Some didn't, some watched. But we created an environment where children had the power of the choice to find their own joy. You can't make somebody joyful. The best you can do is to create an environment where somebody can explore and begin to try to spark their own sense of joy. And so,
that is such a beautiful story, and so I think relevant now, because what I'm hearing people talk about, like when I talk about open up with optimism or optimism as we're thinking about going back to school, people are saying that feels disrespectful, that having that joyful spirit, that positivity, the optimism in the face of people who have lost so much, in the face of violence and racism and disease, it can feel really disrespectful to people to say, let's bat around a beach ball.
Sure. And that's why I think it's really kind of how you do that. And I
Yeah.
think your language and your approach and your recognition and seeing people and inviting them, you know, not saying, hey, everybody, let's play beach ball. You know, people are dying and suffering, and who knows, this pandemic could go around for 2 more years, but let's just play. That's not the message.
Yeah.
You know, the message is we have a lot of challenges ahead of us. And we also recognize that there's a lot of strength and beauty here. And how are we going to leverage that strength and beauty and wisdom to meet the challenge? You know, my other favorite Life is Good t-shirt is no use being pessimistic. It wouldn't work anyway. I always believe in what you focus on grows. It doesn't mean you ignore the problems, but if all you see are the problems, it gets very difficult to find solutions. And so even when we look at something as horrific as racial injustice, if all we see is the problem and we don't see this incredible movement of people who have said enough, and people coming together, and activists and change, and the things that have been accomplished in a short amount of time, sure, there was too heavy a price paid for it. But as Mr. Rogers talked about, whenever something bad happened, his mom used to say, look for the helpers. There's a lot of helpers out there. There's a lot of goodness out there. And so we don't want to ignore it. We don't want to act, you know, that we're discarding or disregarding all the fear and the pain and the suffering. But I think sometimes when you do it right, you give people an invitation to play or an invitation to sit and watch or to participate on however they feel ready to participate. I haven't had a lot of people get offended with me. And I think it's because I think hopefully they see the respect or the knowledge to know that this is not trying to minimize suffering and challenge. It's an approach to figuring out how amidst suffering and challenge, we can still leverage the resources around us.
So
I'm sorry, go ahead, Chris.
Martha, I see a question in our chat box.
Yes.
And it relates to, you know, if you have a child who's depressed or anxious and may not feel joy, you know, I think about joy as something that may be somewhat individualized. How do you help guide that child to find joy?
Well, I think with all, you know, and especially if we talk about, you know, a clinical depression. And again, I mean, there's a lot of factors. So, you know, making sure that children have the right supports, the right resources, the right mental health supports, but also really like getting to know a child and what's meaningful to them. And then figuring out together and partnering with them about how we're going to find, how we might be able to explore finding some joy together. What is it that captivates them? How can you, I think it was, what's the woman's name who the fine art of tidying up? Something Kondo.
Marie Kondo.
Yes, Marie
Right?
Kondo, about this idea of sparking joy. You know, and again, what is it? And I'll tell you again a funny little story. There was a little boy that used to come into the trauma center. And when I worked at the trauma center in Boston, and I'd never met anyone that depressed. So I didn't work with kids clinically. You know, I had an office there. So I come out in the waiting room and I used to just, you know, high five the kids in the waiting room, say what's up, maybe tell them a joke. I could never get this kid to smile at me. Never. You know, he was maybe 12 years old, real depressed, very complex trauma history. And so I'd say to him, you know, we'd be wearing a Celtic shirt and I might be like, hey, you see that game yesterday? I'd just get a stare. I'd say, hey, what's up, man? And I'd try to give him a high five, nothing. I was like, you gonna leave me hanging? He'd just look at me like I was crazy. And one day I was in my office and he came out there and I had a beach ball in my hand because I was it's weird to have a beach ball in your hand, but I had a beach ball in my hand because I was blowing up some new beach balls that we got for a training. And I looked at the kid and I just said, hey, dude, if I tap this beach ball at you, you going to tap it back to me? And he looked at me like I was crazy, but he shrugged his shoulders. And I said, boom, that was my invitation. I tapped the beach ball. He tapped it back to me. I tapped it to him again. Before we know it, we had this interaction of a beach ball tapping. And he laughed and smiled because we knocked something over. We knocked a picture off the wall in the trauma center, and I got yelled at. I always used to get yelled at the trauma center. That's why I'm not there anymore. But at that moment, we experienced this connection. And so I think that piece of not giving up to know, I know you feel so bad, and let's try to figure out some things that we can do that even for a moment might feel exhilarating, might feel joyful. It might just be a moment. It might be getting on and taking a bike ride. It might be playing some kind of game. It might be art, but we have to find out what is meaningful to that child. And if we can't find anything at all, we can't give up. We got to keep tapping in and working with the community, because again, I don't want to downplay if someone has real serious clinical depression. There's a lot. I'm not a clinician, and I'm a clinical social worker, but we would need a group, look at people to say, what can we do to help this child to spark a little bit of joy? And so again, I think not giving up and continuing to look for things that you can do to shake it up, to pull a child from that place and to pull them into a present moment where they can experience some level of felt sense of pleasure and purpose.
Steve, I just saw a really interesting question in the chat about whether you think that there is some inherent privilege in the ability to, or the opportunity to experience joy like that.
Of course. I mean, I think that...
Or to focus on joy, at least.
To focus on joy? No. I don't know. I mean, it's hard for me to tell because I'm a man of privilege. And so I don't know. And I've been able to work with lots of people who don't come from privilege. And joy, I believe, is universally important to people. And I think that it's harder for some people to be able to find joy. So yes, when you're fighting to, for survival, to have enough food to eat, to have shelter, to struggle, and you don't have adequate medical care, it is definitely an obstacle to being able to experience joy. But the focus on joy, and to focus and believe that children deserve to feel joy, I don't think comes from a place of privilege. It's food and water and medicine and clothing allow children to survive. But if you want children to truly live, they got to have some joy. And inherently, I think that just the one thing that one is kind of born with, there's kind of a genetic, some people have an easier time than others finding joy. And we also, so I'm sorry, Chris, you were going to say something.
Well, I was going to say, related to that, I can think about some of the kids I used to teach and how sometimes with joy, we're in their face, just out there in a real loud and active way. And if someone is depressed, coming to them quietly and listening and not making these loud, big movements, but rather being rather soft, sometimes will help, because sometimes it's just over a period of time, being there with someone, sitting with them, listening can help you understand them at a deeper level. I think the connection then, the bonding happens in those small moments. And from that, perhaps you learn something about someone's interests and their needs.
Yeah, I'm looking, Chris, at the questions, and I know Kristen talked about this, privilege connected to safety, and absolutely. I mean, I think that there's, and it's funny. I think about this idea of it's sad that it's a privilege to have some sense of safety as a child, but it's true. And so that you're right, you can't feel joy with no sense of safety. And not just that, but if we look at this idea of connection and attachment, I mean, joy, the greatest joy comes from our relationships. And so when we don't have attachment, we don't have connection, it's hard to find, it's hard to sustain joy. It may even be impossible. But I know, that it's difficult for people to prioritize joy for their children when they need to work so hard just for that child to even be able to survive, to even have access to clean water, to even have access to a roof over their head, or to be able to deal with, interpersonal human aggression and living in war. I was in Rwanda this summer, and the amount of joy that I saw in the Gihembe refugee camp of kids was astonishing. And it's almost like, you can't stop life. It's hard to stop joy for children from experience, or at least looking to experience joy, even with horrific trauma. I watch kids make amazing soccer ball out of a condom, torn clothing, and twine that actually was more durable than some of the soccer balls I've seen here. So I think there is a hunger and a desire for joy. And yes, it is a privilege. I don't know if that's the right word for it, because it shouldn't be a privilege, but we know in reality it is a privilege for some children to feel a sense of safety, for some kids to feel a sense of connection and attachment. And it's for those kids who struggle to find that, how do we as care professionals help them, help?
So Martha, I'm looking at the time and thinking that maybe we should talk a little bit about our back to school toolkit and talk with Steve about some of what we're planning on doing, as well as what he's planning on doing for the fall.
Yeah, I'm wondering if Dana might want to talk a little bit about the back to school toolkit that we did, which I'll let her talk about the content of it. But as part of our initiative in New England, working with fellows in all of the New England states, as a team, we put together a toolkit to help support educators when they're thinking about going back to school in whatever way that might happen, whether it's in person or a hybrid or completely online, but thinking about some of the kinds of questions that are really in line with what Steve's talking about. So Dana, do you want to say a little bit about the content of the toolkit and where people might be able to find it?
Absolutely. So we've been really listening to educators, not only in New England, but across the country, and hearing their concerns. And we worked with a group of school mental health professionals to create this toolkit, really give you some practical strategies to use when you go back to school, whether that's in person or online. And these are our 7 suggestions, which really do align with everything that Steve has been talking about today. I saw in the chat a lot of people asking, what these teachers are fearful. How do we support them as they come back to build that optimism and community? So we understand that making people feel safe is really important, and we give you some concrete ideas to really foster that safety, but also think about equity and making sure that you reach all children regardless of their background. And we also give some great tips on how to build a compassionate community that not only has the students and the staff, but brings the families and community partners as well, because we know that those community partners can be amazing resources to help support the staff and student mental health. We've gotten a lot of questions about mental health screening, and we do address that in our toolkit as well. We give some trauma-informed recommendations, but we also acknowledge that all children and all staff members are coming back with trauma. And because of that, it's really important to use self-regulation techniques, which community partners can be great resources for bringing programs in. We give some research-based ideas for how to acknowledge and address grief, which is going to look different for different people. Some have lost family members. Some schools have lost teachers or even students. Others are just grieving over the loss of not getting to have closure of the last school year, not having their last season of a beloved sport. So looking at all the different ways we can address grief, because it's going to look different for each person. One thing that's really going to be important to support that sense of community is to reestablish some old routines, create some new routines, and make sure that forming a connection is a really important part of those routines. We give some ideas for schools to teach mindfulness, to encourage self-regulation, and also how schools can help parents use those same tools in their own homes. And then our last suggestion is that schools vision for a better future and take some concrete steps to make that future a reality. So we have this toolkit available for you on the New England MHTTC website. There's also a link in this slide, which this slide deck will be emailed to you after the webinar. And we encourage you to reach out to us if you have any questions regarding the toolkit.
So let's think about this. I think one of the conclusions we can draw is that if you want to have a joyful or optimistic opening in the fall, it's going to be important to have some sense of joy and optimism right now in the next few weeks. You know, this is your time to practice. This is the time to savor those few moments and learn from them so that wherever you are in the fall, you will be bringing some joyful experiences, even in the midst of all of this. So you'll have that reservoir that you can turn to, those experiences you can acknowledge, and you can say, that's part of my new toolkit. And that should help you bond and connect with children in a way that will be more joyful, more meaningful for everyone. Steve, would you add to that?
I think these are really important pieces. And language does matter. And so I think that, maybe sometimes when people, we're feeling, I'm finding that, many of us, we're tired, we're frustrated, it's been a long stretch. And so, I think that when people get reactive more to something about like, I'm hearing this thing open up with optimism, this is what it's going to mean to me. These are people who are trying to sugarcoat this or that. But when you start looking at really what that means, it's hard to imagine schools being effective without fostering safety and equity, without feeling a sense of community, without supporting mental health, without acknowledging and addressing grief, without bringing some sort of routine. I mean, these are really essential pieces that, I guess I shouldn't say they're impossible to argue with, because I know people will argue with anything, but they're so sound. And again, I think we're speaking the same language. I think we just sometimes use different words. I'll be honest with you, before I joined Life is Good, so Life is Good, you all know, is a clothing company that's mission is about spreading the power of optimism. I had an organization called Project Joy. It wasn't about optimism, but Life is Good felt like, hey, we love what you're doing around spreading positivity. We'd like you to, we'd like to support the work that you're doing. And it might be really effective if we could tell one story and use one word. So I figured out, how am I going to make optimism work? Because that word didn't mean much to me before. So our defining it by saying our capacity to see goodness and value in ourselves, others, in the world around us, that could be the same definition of joy. So words matter. And so we want to make sure we don't, if people get reactive to say, oh, Jesus, I don't want this optimism BS, go, cool, well, let me tell you a little bit more about it. It's really about safety and equity. It's really about community building. It's really about addressing grief. Well, then I think people may be more open to it. And in terms of things that we would love to be able to do from the Life is Good Kids Foundation is we were able to take our Playmaker 101, which is called the healing power of optimism. I'm seeing a lot of my friends out there. I see playmakers out there. I'm looking at Don and Ginger, and I'm just like, yeah, I can see their face. I'm sure there's other playmakers out there, but we were able to figure out how to do that digitally as a digital learning experience that we want to make accessible, which is called the healing power of optimism. It looks deeper on optimism and cultivating. It looks at the impact of ACEs and adverse childhood experiences and optimism as a tool for addressing those. It looks at what we call social and emotional superpowers and what it means to be a playmaker and how to build those places. We've had since COVID over 1,000 childcare professionals finish the course. And I think 98% of them said that they would refer that course to a friend. And so I know the course is good. And I don't mean that, I hope that doesn't sound arrogant, because I had the team that works on it, and Kate and the Life is Good Playmaker learning team developed an amazing course. And so we want to make sure it's accessible to anyone who wants it. There's some information right over there. There's a link which will be about the healing power of optimism. There's a cohort that's starting on August 10th. We're going to look at this idea of open up with optimism and have webinars for teachers and educational professionals on August 27th. We have some stuff on our Facebook page from our team about little activities and what we call something good for kids and care providers. And really, we only exist to be of support to people who have dedicated their lives to helping kids. You all are the playmakers. You all are the ones that walk the walk every day. It's real easy in some levels to sit and talk about creating old places, creating environments and healing, helping to spark joy. Those are easy things to talk about, and they're not easy things to deliver day in and day out, especially with kids whose lives have been, torn apart by horrific adversity. So any way that we can be of support, I'll even give you my direct email, which is pretty easy to remember, which is steve@lifeisgood.com. I'm a good email returner, but I take a long time sometimes. I'm working on it, but email is like a little bit of my nemesis, but I promise to get back. It just won't be tomorrow. But if you have questions, and again, you can get all this information here. But what you all do in the world, and people who have right now, we need to rise up. And I hear you when we talk about, hey, if someone is afraid and they have really compromised and they're afraid and can't go back into the classroom, we need to create environments where those folks don't have to. I mean, where we look at alternatives. People have to be able to have choices, and to force people to overwhelm themselves and to end up becoming, whether they get sick or incapacitated from being overwhelmed by stress. I mean, we have to protect our workforce. And so it's on every system to look and to be communicating with their educators and looking at, there's some people who are chomping at the bit and can't wait to get back to the classroom. And there's others right now for very good reasons. And everyone has their own reason, who the thought of going back to a classroom is completely overwhelming. So how do we care for both of those folks? How do we care for our workforce? Because there's amazing work that educators can do without being in the classroom. Many schools are going to need a hybrid learning approach. So putting people in positions where they can be empowered and succeed is our responsibility as leaders to figure out how to do that.
Dana, do you have a bit more to share? And we could also open this up for questions right now. So as we're closing down, if we have a few questions, let's go ahead and go ahead and type them in the chat box or raise your hand, and we'll try to have a bit of a discussion for maybe 5 or 10 minutes. Okay. So Dana, do you want to share first?
I will say that if you're interested in what the Childhood Trauma Learning Collaborative is doing as part of the MHTTC, we do have a really wonderful online repository on the site Basecamp, which has all sorts of topics for educators having to do with visioning and mental health supports, tiered services, compassion in schools, equity, and lots of resources, and also lots of opportunities for educators to communicate with each other and offer support and ideas and resources about how they are opening up with optimism, or opening up with optimism, right? That's
yeah.
And so, you know, we would love to invite you over to see that platform. You will get some information about how to do that at the end of this webinar.
Yeah, so you will actually receive an email that will invite you to join our Basecamp community, and it's absolutely optional. So if you don't want to join, just don't click on the link. And if you join by accident, just send me a message and I can unsubscribe you if you like.
And yes, to Ann Keebler, what we've shared on the screen, I'm not sure if you mean these resources or the a recorded copy of this webinar, but both of those things will be available to you. And they are, we would love for you to share them as widely as possible.
Yeah, and the resource, the toolkit is available on the MHTTC website, but also as a link in this slideshow. And these resources that Martha just described are all archived on our Basecamp. So if you want to access those, do make sure you click through on the link that will be sent to your email and join the Basecamp to find all of those archived resources. We also invite any educators who are in the New England area to join the Childhood Trauma Learning Collaborative, where we do have special webinar meetings and also access to our school compassionate culture analytical tool for educators for free. We do have an upcoming training in Maine where Dr. Staley and Dr. Mason and myself will be introducing the Compassionate School Mental Health Model for a one-day free virtual training workshop for educators and any community members in Maine that work with youth. Again, Life is Good has a few really great upcoming offerings, which Steve described, so make sure to check those out. And we also just wanted to thank you for joining our webinar today. Our funding comes from SAMHSA, which does require us to evaluate our services. Attendees that provided their email address will receive an evaluation survey 24 hours after the close of the event, along with the slide presentation, and a link to request CEU credit or a participation certificate. We do appreciate your honest and anonymous feedback because it helps us provide information to SAMHSA and assists us in planning future meetings and programs. We hope that you make plans to participate in any of our online activities that are coming up. And for more information, please do reach us at info@edimprovement.org. Thank you so much, everyone.